specific presenters. Our next speaker is Dr. Masahiro Natsuaki from Kyoto University, who presented this morning an extraordinarily interesting paper on the one-year outcome of a trial comparing second-generation drug-eluting stents using either biodegradable polymer or durable polymer. The next trial.
Thank you very much. Drug-eluting stent has dramatically reduced the rate of restenosis. However, late adverse events such as very late stent thrombosis or late TLR has emerged as a new enemies of the drug-eluting stent. And the polymer is reported to be related to those late adverse events. And to overcome the polymer-related adverse events, biodegradable polymer Biolimus-eluting stents have been developed. And the purpose of this study is to evaluate the efficacy and safety of Biolimus-eluting stent compared with the Everolimus-eluting stent, which is the gold standard drug-eluting stent. The next trial is a multi-center randomized non-inferiority trial comparing NOBORITM Biolimus-eluting stent with Science Everolimus-eluting stent. The randomization was conducted in one-to-one fashion. 30 to 100 patients were to be scheduled for PCI using drug-eluting stent were to be enrolled without any exclusion criteria. And primary efficacy endpoint of this study is any target lesion revascularization at 1 year. And primary safety endpoint was death or MI at 3 years. And we also conducted angiographic sub-study. And primary angiographic endpoint was in-segment rate at 8 to 12 months. Cumulative incidence of TLR through 1 year was 4.2% in both groups. Non-inferiority of Biolimus-eluting stent compared with Everolimus-eluting stent was demonstrated in terms of TLR rate at 1 year. Cumulative incidence of all-cause death was also similar, 2.6% in the BS group and 2.5% in the ES group. Regarding stent thrombosis, cumulative incidence of definite stent thrombosis was very low and not significantly different between the two groups, 0.25% in the BS group and 0.06% in the ES group. Regarding the primary angiographic endpoint, in segment rate loss was 0.03 millimeters in the BS group and 0.06 millimeters in the ES group. So biodegradable polymer Biolimus-eluting stent was demonstrated to be non-inferior to durable polymer Everolimus-eluting stent in terms of 1 year TLR rate and 8 to 12 months 8 to 12 months in segment rate loss. And 1 year clinical outcome of both ES and BS use was excellent with low rate of stent thrombosis and very low, low rate of TLR and very low rate of stent thrombosis. Thank you.
Cindy Grimes, the co-chair of TCT at ACC, is going to comment on this. Cindy.
This is a very, very exciting trial. Unfortunately, this is a type of stent that is not available here in the United States, but there's a lot of interest in stents. So basically, our normal stent has a metal component. It has a polymer, and the point of the polymer is for the drug to stay on that polymer and be released. Well, you remember those problems we had with old drug-eluting stents with the late stent clotting and inflammation. It's all thought to do to the polymer. So this particular stent has a polymer that dissolves over time. And the thought is that if that polymer is no longer present, then this stent would be safer in the long run. The amazing thing about this trial is that they enrolled 3,200 people. They were pretty high risk, actually very advanced age, lots of diabetes, 51% had multivessel disease, and their clinical outcomes were amazing in both groups. And if you look at the long-term, at a month, there was only 3% of patients in both arms that needed to have a repeat procedure done. Very, very, very low rates of stent clotting up to the first year. It was, I think one was 0.06%, the other one was 0.25%. And so that's incredibly spectacular as well. And so I think that there's a couple things I want to say. I think that we're doing a better job at taking care of patients with these newer generation stents, whether it's got the bioabsorbable polymer or just the current second generation of stents. For this particular trial, I think that the long-term benefits, though, are what can be particularly important. So what we are really worried about is this late stent thrombosis, and that's where the polymer might make a big difference, the fact that the polymer is no longer there. So we're going to keep an eye on this study and see how things go. Now, also we have other stents out there, so this isn't the end of the story, but it's like, because we have the entire stent that can dissolve as well, and there's several versions of those in testing right now as well.
Thank you, Cindy.